Hey everyone, my name's Dr. Christina Coblish and I work at Upper Cervical Chiropractic of Boulder. Today I want to talk a little bit about TMJ dysfunction, TMJ pain, jaw pain, and exactly why you might need upper cervical care. First, let's talk a little bit about what TMJ is. So the TMJ describes your temporomandibular joint, which is essentially the connection between your jaw and your skull. Your TMJ sits right in this area here. Your mandible is one of the strongest bones in your body, which means that it's incredibly useful. The downside is that when it's not working properly, not functioning properly, not feeling right, usually most people are really unhappy. TMJ dysfunction is actually fairly common. An estimated up to 10 million people suffer with some sort of TMJ dysfunction. And the worst part is TMJ isn't just limited to pain and dysfunction right around your jaw. It can also lead to inner ear issues like vertigo and tinnitus. It can cause neck pain, popping. Any of this sound familiar? We use our jaw all the time to talk, to eat, to laugh, and when you have any kind of TMJ pain or discomfort or dysfunction, it really leaves you in a bad place. The word mandible in Latin literally means to chew or to use for chewing. Our mandible and our TMJ are essential to daily life, and when it's not working properly, boy is it noticeable. As mentioned before, a lot of people suffer from TMJ dysfunction, and a lot of people seek different types of care or treatment when trying to address these symptoms. If you go to your medical doctor, they might prescribe you an anti-inflammatory or a muscle relaxer. There's also options of getting Botox injections or dry needling. Or if you look on Pinterest, you'll find solutions like herbal remedies, self-massage techniques, etc. And while these are all great options, and for many people this does provide pain relief, wouldn't you prefer a solution if someone had the answer? In the upper cervical world, any kind of TMJ dysfunction is looked at as a symptom. Your TMJ is located incredibly close to your upper cervical spine. Just to show you on our model here, this is your skull, back of your skull, your C1 and your C2. Your TMJ joint sits right in this pocket right here. So if you have any kind of misalignment in this area, can you see how it's going to take your TMJ and it's not going to allow it to sit properly, move properly, function properly, and probably most importantly for you, it's going to lead to you not feeling like it's moving properly. You're going to feel the tension, feel the dysfunction. Some people start to get those symptoms, like I mentioned earlier, in your inner ear, such as the tinnitus and vertigo and pain into this corner pocket of your neck. Your upper cervical spine may not seem like the most obvious connection to what could be hindering your healing ability to your TMJ, but in many cases it is for our patients here at Upper Cervical Chiropractic of Boulder. A misalignment in your upper cervical spine can cause unnecessary stress and tension on your TMJ joint, and this can lead to a snowball effect of different symptoms. So exactly how can an upper cervical adjustment help with TMJ pain and dysfunction? For many people, it doesn't take much to create a possible misalignment in your C1 or your C2 upper cervical spine, considering the size of these bones, the way that they move, and the overall delicacy of them. In some cases, we can trace these misalignments all the way back to a traumatic birth injury. For other people, it was playing sports as a kid, or maybe you just fell off your bike when you were 5 and thought you were fine because you just had a little bump or scrape. But really this set in an upper cervical misalignment that continued to progress into adolescence and adulthood and didn't manifest until the very last symptom showed up, which is TMJ stress or dysfunction. Your spinal cord runs right through your upper cervical bones. When these two bones misalign, your nervous system cannot function the way that it's meant to. And this is when we'll start to see symptoms arise, such as neurological symptoms, pain and tingling, radiation, and yes, in some cases, TMJ pain. When you receive a very precise and very specific upper cervical adjustment right behind your TMJ joint to your upper cervical spine, this allows the tension to release, allow things to start moving more freely and flowing more freely through this area. And this is where we see a lot of resolution of pain and symptoms in our patients. If you've been experiencing TMJ pain, we highly encourage that you reach out to our office and see if upper cervical care might be the right solution for you, just like it has been for many of our patients here. Again, I am Dr. Christina Coblish. Thank you so much for tuning into our video, and stay tuned for our next video where I will talk a little bit more about why your neck pain and migraines might be related. Thank you so much. Catch you in the next video.